Thank you.
From Bordeaux.
Thank you, dear Chairman. I will present the result of our study comparing accuracy and reliability of spinal curvature and rotation data based on patient-specific three-dimensional models created by EOT three-dimensional imaging system and three-dimensional Moiré-Fringe technique. As you know, 3D representation of the spine offer better assessment of spinal and pelvic posture, a better evaluation of the effect of corrective treatment, and a better understanding of the mechanism in pathology's progression. Currently, the gold standard using in our hospital is EOS with the stereo software. EOS offers a simultaneous cap wall body with biplanar X-ray imaging by slot scanning, wall body in upright physiological load-bearing position, and it is a calibrated radiological environment. While Moiré-Fringe technique uses an optical process, assessing the three-dimensional geometry of the back by analysis of the deformation induced by the relief on successive system of projected luminous bands. This technique, coupled with any numeric acquisition of conventional biplanar X-ray, allows restoring calibrated environment with radiological installations. So we want to compare the Moiré-Fringe technique that use the biomod software and EOS technique that use stereo software. The three-dimensional reconstruction was performed twice by one radiologist and one radiographer with the two software. Inter-rater reliabilities and intra-rater reliabilities were estimated for all spine curvature and pelvic parameters. 62 patients were included. 20 had pedicle implants and 3 had hip replacement. 25 patients had scoliosis with a mean angle of 37 degrees. As you can see, using stereos, the reliability, intra-rater reliability was excellent with intra-class correlation coefficient higher than 0.8 for all parameters. With biomod, we find similar results except for axial rotation where ECC was fair to good. For inter-rater reliability, we find excellent ECC using stereos and also using biomod with similar results for axial rotation where intra-class correlation coefficient was fair. When we compare the results of the two software, we find significant difference for all spinal curvatures. However, the person correlation coefficient was high for all this data. And furthermore, the 95% confidence interval prediction was 4.1 degrees for coronal curve, that is quite low. And for axial rotation, we don't find significant difference. And the maximum 95% limit was 0.13. The reconstruction time was higher using biomod with a mean of 18 minutes, whereas it was around 13 minutes using stereos. However, you can see a height variation in reconstruction time between the two raters. Indeed, rater 2 had a mean reconstruction time of 14 minutes, whereas rater 1, it was 21 minutes. Our study has several limitations. Indeed, it's an heterogeneous sample. Some patients had scoliosis, pedicle implants, or hip replacement. Furthermore, the Razor 1 was a regular user of stereos since 6 years at the beginning of the study. That could lead to a better accuracy using stereos and a longer reconstruction time using biomod. But we can conclude that Moiré-Fringe technique and the spine reconstruction using biomod, it's an accurate and reliable tool to perform three-dimensional reconstruction of the spine in weight-bearing position and to quantify the vertebral rotations. Thank you.
Thank you. Any comments or questions from the audience? Thank you.
Thank you.